Diabetes. What exactly is diabetes? Diabetes is one of the most common health conditions in the world today. Millions of people live with it, and even more may not know they have it. But what really is diabetes? Why does it happen? And how can we manage it? In this video, we're going to break it down in the simplest way possible. From how food turns into energy, to the role of insulin, the types of diabetes, their symptoms, and how they are treated. You'll have a clear picture by the end. Let's start with food, because that's where it all begins. Most of the foods we eat contain carbohydrates. Think of rice, bread, pasta, potatoes, fruits, and even sugary drinks. When you eat them, your digestive system breaks them down into a simple sugar called glucose. Glucose is important because it's the main source of energy for your body. Just like a car needs fuel to run, your body needs glucose to power your muscles, brain, and organs. But here's the catch. Glucose cannot enter your cells on its own. It needs a helper. This is a crucial fact. This is where insulin comes in. Insulin is a hormone produced by the pancreas. Think of insulin as a key. Your body's cells are like locked doors, and glucose is like someone waiting outside with energy. Insulin is the key that unlocks the door, allowing glucose to enter the cell and be used as fuel. When everything works well, glucose enters the cells, energy is produced, and your blood sugar levels stay balanced. But if insulin is missing or not working properly, glucose gets stuck in the blood instead of entering the cells. This is where problems start. Your body likes to keep blood sugar within a certain range, not too high, not too low. When blood sugar is too low, hypoglycemia, you can feel dizzy, shaky, or weak because your body isn't getting enough energy. When blood sugar is too high, hyperglycemia, it can damage organs and blood vessels over time. That's why insulin and balanced blood sugar are so important. And when this balance is lost, we enter the world of diabetes. Now let's talk about the main types of diabetes. 1. Type 1 diabetes. This usually starts in childhood or young adulthood. Here, the immune system mistakenly attacks the pancreas, destroying the cells that make insulin. That means the body produces little to no insulin at all. People with type 1 diabetes need daily insulin injections to survive. 2. Type 2 diabetes. This is the most common type, usually developing in adults, but now also seen in younger people. In type 2 diabetes, the body makes insulin, but the cells don't respond to it properly. This is called insulin resistance. In insulin resistance, those doors stop responding properly. It's like the lock has gotten rusty, and even though insulin is knocking, the cells just don't open up the way they should. So what happens? Glucose stays stuck in the blood. The pancreas notices this and says, maybe I need to make more insulin. So it pumps out extra insulin to try and force glucose into the cells. At first, this kind of works, but over time, the pancreas gets tired and it can't keep up anymore. That's when blood sugar rises and diabetes sets in. Why do the cells become resistant in the first place? A few reasons. Extra body fat, especially around the belly. Lack of physical activity, because active muscles actually make insulin work better. Unhealthy diets that are high in processed and sugary foods. And of course, genetics. Some people are naturally more at risk. The good news is insulin resistance can be improved. Things like regular exercise, healthy eating, and losing even a small amount of weight can make your cells more sensitive to insulin again. In some cases, this can even bring blood sugar levels back to normal without medication. So think of insulin resistance as the body's early warning system. Your cells are basically saying, we can't use glucose properly anymore. And that's the time to make changes before things get worse. 3. Gestational diabetes. This type happens during pregnancy. During pregnancy, the body produces special hormones to help the baby grow. Some of these include estrogen, progesterone, cortisol, etc. These hormones are very important for the baby, but they also make the mother's cells less sensitive to insulin. Think of it this way. The hormones act like noise in the background, making it harder for insulin's message to be heard by the cells. The pancreas tries to make more insulin to overcome this resistance, but in some women, it's not enough. That's when blood sugar levels rise, leading to gestational diabetes. Usually this doesn't cause noticeable symptoms, which is why routine pregnancy screening is so important. But if it's not managed, it can cause problems. The baby may grow larger than normal, making delivery more difficult. The baby may have low blood sugar after birth because it's used to high sugar levels in the womb. For the mother, there's a higher risk of high blood pressure during pregnancy. The good news is that gestational diabetes usually disappears after childbirth, but it leaves behind a warning sign. Women who've had it are more likely to develop type 2 diabetes later in life, so regular checkups are important. Treatment focuses on healthy eating, staying active, and checking blood sugar often. If that's not enough, insulin can be used during pregnancy. It's safe for the baby. So how do you know if someone may have diabetes? The symptoms often come from high blood sugar staying in the blood instead of going into the cells. Frequent urination. The body tries to get rid of excess sugar through urine. Increased thirst. Because you're urinating more, your body gets dehydrated. Unexplained weight loss. Without glucose entering the cells, the body starts burning fat and muscle for energy. Fatigue cells aren't getting enough fuel, so you feel weak and tired. Slow healing wounds. High blood sugar damages small blood vessels, slowing healing. Blurry vision. Too much sugar in the blood can cause fluid changes in the eye. If these symptoms are noticed and left untreated, diabetes can silently damage the heart, kidneys, eyes, and nerves over time. Some people are more likely to develop diabetes than others. Type 1. Diabetes risks family history, genetics. If you have a close relative with type 1 diabetes, like a parent or sibling, your chances of developing it are higher. Scientists believe certain genes make some people more likely to have their immune system attack the pancreas. Certain autoimmune conditions. Type 1 diabetes itself is an autoimmune disease, which means the body's defense system mistakenly attacks its own cells. Instead of fighting off germs, the immune system attacks the beta cells in the pancreas that produce insulin. Other autoimmune diseases include celiac disease, Addison's disease, etc. Possible viral infections in childhood, still being studied. Type 2 diabetes. Risks: being overweight or obese, lack of physical activity, unhealthy diet, high in sugary and processed foods. Family history of diabetes. Age, risk increases as you get older. High blood pressure or high cholesterol. Gestational diabetes. Risks obesity before pregnancy. Family history of diabetes. Being older than 25 during pregnancy. Certain ethnic backgrounds, African, Asian, Hispanic, Native American. Here's a simple breakdown. Cause. Type 1 is an autoimmune attack. Type 2 is insulin resistance. Onset. Type 1 often starts young. Type 2 usually later in life, but not always. Insulin. Type 1 requires insulin injections for life. Type 2 may be managed with lifestyle, tablets, or insulin if needed. Prevention. Type 1 cannot be prevented, but type 2 can often be delayed or prevented with healthy lifestyle choices. The good news is that diabetes can be managed. Treatment depends on the type. 1. Lifestyle changes. Eating balanced meals with whole grains, vegetables, fruits, lean proteins, and healthy fats. Regular exercise to improve insulin sensitivity. Maintaining a healthy weight. 2. Medications. Type 1, daily insulin injections or an insulin pump. Type 2, Oral tablets, like metformin, to help the body use insulin better. Some may eventually need insulin too. Gestational, diet and exercise first, insulin if needed during pregnancy. 3. Monitoring checking blood sugar regularly to stay in range, using devices like glucometers or continuous glucose monitors. 4. New advances artificial pancreas systems that automatically adjust insulin. Better insulin delivery methods. Research on potential cures, though still ongoing. The key message: with proper treatment, people with diabetes can live long, healthy lives. Diabetes may sound scary, but understanding it makes it less mysterious. It all comes down to how the body handles glucose and insulin. When that balance is lost, blood sugar rises and problems follow. The important thing is awareness. By knowing the symptoms, recognizing the risks, and taking steps to live healthier, we can prevent type 2 diabetes and manage all types more effectively. Diabetes is not the end of the road. It's a condition that can be managed with knowledge, care, and commitment.